Hello, I am Dr. Harpreet, Senior Consultant and Head of the Department Transfusion and Lab Medicine at Aakash Healthcare, Dwarka, Delhi. On the occasion of World Donor Day, I would like to thank all of our donors who have volunteered and come to our blood center to donate blood. Thousands of donors donate blood each day, but few know the amazing journey that the bag goes on. It involves many people, many processes, and some fascinating science. So let's go on your blood donation journey. Let's see the donation process at the blood center. Once the donor arrives at the blood center, they have to fill out a donor form which asks you about your health, followed by pre-donation counseling and a mini health checkup. This is where we measure your blood pressure, your temperature, hemoglobin, etc. This is followed by the examination by the medical officer of the blood center, and after all this, we can decide whether you are eligible to donate blood or not. This all process is to make sure to protect the health of the patient and, more importantly, the blood donor. Once all this is done, our donor team will start your blood donation process. Your blood is collected in a special sterile bag which is connected with a single-use sterile needle. This special bag contains an anticoagulant that ensures that the blood does not clot. The blood is mixed gently with an anticoagulant by gentle rocking on the blood mixer. Of the main bag, a few sample tubes are collected for testing also. Either 350 or 450 ml of blood is collected from one donor. The whole process takes only about 5 to 10 minutes. Following this donation process, there is a light refreshment for all the donors, and post-donation counseling and advice is provided by the counselor. The whole donation process takes about an hour, but your blood journey has only just begun. Now, let's see what happens to the blood after donation. All the donations are given a unique number to maintain traceability throughout every single stage of the entire process. The tubes collected at the time of donation are taken for testing. At blood center, the first tube is taken for blood grouping and checking for the presence of irregular antibodies to the serology section. The second tube goes for infectious marker testing. We test for HIV, hepatitis B, hepatitis C, malaria and syphilis, and all these tests are performed here in the TTI lab. In addition to these tests, we also do nucleic acid testing for HIV, HPV and HCV on all the donated blood. Again, all of this is to ensure patient's safety. The blood bag having the same unique ID goes to the component lab. This is where the blood is separated into various components by a very special refrigerated centrifuge machine. After centrifugation, the red cells form the bottom layer in the bag, the platelets the middle, and the top yellow fluid is the plasma. Following the entire procedure, we get three products: the packed red blood cells, also called as PRVCs, the fresh frozen plasma, commonly known as FFP, and platelets. These three products can go to three different patients with different needs. And this is why one donation can save 3 lives. All of these blood products are stored in respective refrigerators with continuous temperature monitoring. Once all the tests are done and the blood is found safe for issue, it is ready to be issued to a patient. All of this is done every time you donate blood. And this is done just to ensure that only safe blood is issued to the patient. Lastly, in the hospital, the requests are received for the patient and the right blood is issued to the patient from our blood center. Blood and its components are used in many cases like surgeries, in delivery, cancer treatment, red cell disorders. Accidents may need larger volumes of blood, and all of this help for the patients is possible only by you. So once again, from the entire Aakash Healthcare family, I would like to thank each and every one of you for giving the gift of life.